There's a number that should terrify every person over the age of 60, and almost nobody has heard it. Pancreatic cancer takes more lives among older adults each year than colon cancer does, and yet most seniors couldn't name a single early warning sign if you ask them right now. That's not an accident. That's the design of this disease. It doesn't announce itself. It whispers, using the same language your body already uses to talk about getting older. A little more tired, a little less hungry, a little achy in the back. And because those whispers sound so familiar, so ordinary, they get ignored, sometimes for months, sometimes long enough that the window to do something about it quietly closes. Here's the part that should really stop you in your tracks. The signs are there long before the disease becomes untreatable. They can show up half a year, sometimes longer, before a diagnosis is ever made. That's not a small window. That's time, real time, where a conversation with the doctor and the right scan could completely change how someone's story ends. The problem has never. That it speaks in a language we've all been trained to misunderstand. Today we're going through 8 signals your body may already be sending. Some of them you've probably heard of. A couple of them will surprise you, because they don't sound like cancer symptoms at all. They sound like a blood clot, a fever that won't quit, a night sweat. Stay with me through all 8, because it's the combination that matters most, not any single one in isolation. And near the end, I'll walk you through exactly what to say to a doctor, to make sure you're taken seriously the first time you bring this up, not the 3rd or 4th time. Before we get into the list, it helps to understand why this particular organ gets away with so much for so long. Your pancreas sits deep in your abdomen, tucked behind your stomach, out of reach of any physical exam. Your doctor can press on your belly during a checkup and feel absolutely nothing unusual, even if something is already growing. In there. Standard blood work doesn't screen for it either. There's no routine test that lights up early. By the time imaging typically catches it, the disease has often had a significant head start. That's not a failure of your doctor. It's simply the nature of an organ that hides in plain sight, which is exactly why paying attention to what your body is telling you matters so much more here than it does with almost any other cancer. It also helps to know who tends to be at higher risk, because context changes how seriously a symptom should be taken. Risk climbs with age, and the majority of cases are diagnosed in people over 65. Long-term smoking roughly doubles the risk. A history of chronic pancreatitis, long-standing type 2 diabetes, obesity, or a family history of pancreatic cancer all raise the baseline as well. None of that means someone without those factors is in the clear, and it doesn't mean everyone with those factors will develop this disease. It simply means that if you check a few of those boxes and you're also noticing symptoms from the list below, the case for getting checked promptly becomes that much stronger. Let's start with something that sounds almost too mundane to matter: the color of your urine. Most people who notice their urine has turned unusually dark do the same thing. They drink more water. It lightens up, they feel relieved, and they move on with their day. But here's what's actually happening when that darkening is tied to something more serious. Your pancreas sits right next to the bile duct, a small tube responsible for carrying a substance called bilirubin from your liver into your intestines. Bilirubin is what gives urine its normal pale yellow tone and stool its usual brown color. When a tumor forms in the head of the pancreas, the section closest to that duct, it can press against it, gradually narrowing or fully blocking the passage. With nowhere else to go, bilirubin backs up into the bloodstream, and your kidneys try to clear the excess by pushing it out through urine. That's what produces the telltale dark yellow, amber, or cola-colored urine some people notice. The detail that separates this from ordinary dehydration is persistence. Dehydration responds to water. This doesn't. You hydrate, it lightens for a day, and then it darkens again, because the obstruction hasn't gone anywhere. If you've noticed this cycling pattern for more than 2 weeks, regardless of how much water you're drinking, it's worth mentioning to your doctor specifically as a change in urine color that hydration doesn't resolve. That one sentence, said clearly, tends to get taken far more seriously than, "I think I might be a little dehydrated." The second sign is one that often gets a name attached to it early, just the wrong one. Doctors sometimes chalk it up to arthritis, a strained muscle, an old injury, flaring up, or acid reflux. And while that misdiagnosis runs its course, the actual problem keeps growing. Pancreatic pain tends to have a fairly specific pattern once you know what to look for. It usually starts as a dull, ongoing ache in the upper abdomen, not the lower belly, not the sides, but the central area just below the breastbone, sometimes leaning slightly to the left. Over time, it doesn't stay contained. It tends to wrap around the torso and settle into the middle of the back, which is why so many people describe it as feeling like a tight band cinched around their midsection. This happens because the pancreas is surrounded by an unusually dense cluster of nerves, and as a tumor grows or presses into nearby tissue, those nerves fire pain signals outward in multiple directions at once. As thumbnail Joe TX at Hunusker remove Chrome, 3 details tend to distinguish this from a typical backache. It often worsens 30 to 60 minutes after eating, rather than immediately. It tends to intensify when lying flat, which is why some people find themselves sleeping propped up on extra pillows or in a recliner without quite knowing why that position feels more comfortable. And it usually doesn't respond well to the things that normally help musculoskeletal pain: heating pads, over-the-counter pain relievers, rest. If you take note of those specifics, where it is, when it worsens, what doesn't fix it, and bring that exact description to your doctor instead of a vague, "my back's been bothering me," it changes the kind of investigation that follows. It's worth adding one more layer of nuance here, because pain is one of the trickiest symptoms to interpret on its own. Plenty of people over 60 deal with genuine arthritis, degenerative disc issues, or old injuries that flare with weather or activity. The goal isn't to assume the worst every time your back ache. It's to notice when a pain pattern breaks from what you'd expect, when it doesn't ease with the usual remedies, when it's tied to eating, when it's accompanied by other things on this list. Context is everything, and that's true for every symptom we're about to cover, not just this one. The third sign shows up somewhere most people would never think to look for cancer: your dinner plate. You sit down to eat, and 3 or 4 bites in, you're done. You push the plate away, tell yourself your appetite just isn't what it used to be, and think nothing more of it. But a tumor growing near the stomach can physically press against it from behind, shrinking how much food it can comfortably hold. At the same time, if the tumor is interfering with the pancreas's ability to produce digestive enzymes, food lingers in the stomach undigested far longer than normal, which reinforces that sense of fullness and suppresses appetite even further. The consequence is unintentional weight loss, and this is one of the most important red flags in all of medicine, not just in pancreatic cancer. Losing more than about 5% of your body weight over 2 to 3 months, without changing your diet or exercise habits, is never something to brush off as a lucky break. If you've dropped 10 or 15 pounds without trying, that's information your doctor needs, framed exactly that way. Sudden, unexplained, and tied to eating less because you feel full faster than you used to. There's also a related warning sign worth mentioning alongside this one, because the two often travel together: the sudden onset of diabetes, or a noticeable worsening of blood sugar control in someone who already has it later in life with no obvious lifestyle explanation. The pancreas doesn't just handle digestion, it also produces insulin, and a tumor disrupting that function can cause blood sugar to spike in ways that seem to come out of nowhere. If a doctor mentions new onset diabetes in someone over 50 who hasn't gained significant weight or changed their diet, that's a detail worth remembering, not just treating as an isolated diagnosis to manage with medication and move on from. The fourth sign is the one that's usually the most visible and often the most misread because it looks so much like something far more common. Jaundice happens when bilirubin builds up so much in the bloodstream that it starts depositing in the skin and eyes, giving both a yellowish cast. In people with darker skin tones, it often shows up most clearly in the eyes and the palms rather than across the whole complexion. What catches most people off guard is a symptom that tends to come along with it: intense, all-over itching with no rash and no relief from lotion or antihistamines. That happens because bilirubin deposits irritate nerve endings in the skin directly, and it won't let up until the underlying blockage is addressed. Here's where it gets tricky for seniors specifically. Jaundice caused by a pancreatic tumor looks nearly identical to jaundice caused by gallstones, which are extremely common in people over 60. A doctor seeing yellowing skin will often reasonably suspect gallstones first and order the tests that make sense for that. That's not wrong, but it does mean the deeper investigation can sometimes take longer to arrive at if the fuller picture isn't presented up front. This is why it helps enormously to describe all of your symptoms together rather than one at a time across different visits. Dark urine, upper abdominal pain that radiates to the back, feeling full after a few bites, and now yellowing skin or eyes, presented as a single connected picture. That combination points doctors toward a broader workup much faster than any one symptom would on its own. Now here's a sign that almost nobody associates with this disease, and it has a track record of putting people in the emergency room before anyone connects the dots back to the pancreas. Certain cancers, including pancreatic cancer, can release substances into the bloodstream that make blood more prone to clotting than it should be. The most common place this shows up is deep in the veins of the leg. A calf or thigh that swells, feels warm to the touch, and aches with a heavy, persistent pressure that doesn't ease up with rest or elevation. Medically, this is sometimes referred to as a perineoplastic clotting phenomenon, and it's genuinely one of the more serious signs on this list because a piece of that clot can break loose and travel to the lungs. If sudden shortness of breath, sharp chest pain that worsens with breathing, or when a racing heartbeat show up together, that's a call to emergency services, not a wait-and-see situation. Research has documented cases where an unexplained blood clot appeared as the very first sign of pancreatic cancer, sometimes months before any other symptom or diagnosis followed. That's a striking piece of information and an important one, but it's also worth keeping in perspective. Blood clots have plenty of far more common causes, from long flights to recent surgery to underlying vein conditions. The point isn't to panic over every clot. It's that if you've had a clot with no clear explanation at all, it's entirely reasonable to ask your doctor whether an abdominal workup should be part of ruling things out, especially if any of the other symptoms on this list sound familiar too. The sixth sign tends to arrive on a strange, repeating schedule, which is exactly what makes it so easy to dismiss. A low fever shows up, fades after a day or two, and then returns a few days later. Most people assume it's a lingering virus, something going around the neighborhood or the family, but a true infection typically resolves and stays resolved. A fever that keeps cycling back over weeks without ever fully going away often reflects ongoing inflammation rather than a single infection your immune system is actively fighting off and winning against. Pancreatic tumors can trigger this kind of chronic low-grade inflammatory response, sometimes compounded by bile duct blockage. And the result is episodes of phalange suddenly chilled, even in a warm room, followed by a mild temperature elevation that he never quite reaches sick, but never quite disappears either. When this pattern shows up alongside night sweats, waking up damp, without having been overheated at bedtime, it's a combination worth specifically flagging to a doctor as recurring, unexplained fevers with night sweats, rather than describing it as, I keep catching something. The seventh sign is fatigue, and it deserves a more careful description than just tired, because the kind that matters here feels genuinely different. Ordinary tiredness usually has an identifiable cause: a rough night's sleep, a physically demanding day, stress, and it responds to rest. The fatigue that tends to accompany pancreatic cancer often doesn't follow that pattern. Someone can sleep a full 8 or 9 hours and wake up feeling like they never slept at all. Tasks that were never a problem before, walking to the mailbox, carrying in groceries, climbing a single flight of stairs, suddenly require a disproportionate amount of effort. Part of this comes down to biology. Cancer cells are metabolically demanding, competing with normal tissue for glucose and nutrients, which can leave the rest of the body running on less fuel than it needs. If exhaustion has felt heavier, more total, and more resistant to rest than anything you've experienced before, and it's been going on for several weeks, that's worth raising as its own distinct symptom, rather than folding it into getting older. And now, the eighth sign, the one that shows up in the bathroom, the one almost nobody talks about, and the one that, when present, tends to be one of the more specific indicators on this entire list. The pancreas produces enzymes that break down fat during digestion. When a tumor blocks the pancreatic duct, those enzymes can't reach the small intestine, and fat passes through the digestive system largely undigested. This changes stool in ways that are genuinely distinctive. It can turn noticeably pale, sometimes gray or clay, colored instead of the usual brown, take on a greasy, oily appearance, float rather than sink, and carry an unusually strong odor. This combination, pale, greasy, floating, foul, smelling stool, is medically known as steatorrhea. And when it persists for more than 2 weeks, it's specific enough that it deserves a prompt phone call to a doctor rather than being written off as something you ate. It's often accompanied by nausea after fatty meals, occasional vomiting, and a general sense of heaviness or discomfort after eating, all of which stem from the same underlying enzyme disruption. So now you have all 8. On their own, several of these symptoms could point to dozens of far more common and far less serious conditions. That's genuinely true, and it's worth saying plainly so this doesn't turn into needless panic. Most dark urine is dehydration. Most back pain is muscular. Most fatigue is just fatigue. What matters is the pattern, not any single symptom in isolation. If you're noticing 2 or more of these together, especially the ones that don't have an obvious ordinary explanation, that combination is what deserves a real conversation with a doctor, not a wait-and-see approach. One more thing worth understanding before we get to what to actually do with this information. Why early detection matters and so disproportionately with this particular cancer. Unlike some cancers that grow slowly and give you years of opportunity to catch them, pancreatic tumors tend to progress quickly and often spread to nearby structures before they're large enough to be found through routine screening. That's part of why. There's currently no broad screening test recommended for the general population the way there is for colon or breast cancer. The tools available work best when there's already a reason to suspect something, like the symptoms we've just gone through, or a strong family history that puts someone in a higher risk category where doctors may recommend more proactive monitoring. That makes symptom awareness disproportionately important here compared to almost any other cancer, because for most people, symptoms are the first real signal available at all. It's also worth saying clearly, None of this is about self-diagnosing from a video. It's about giving you the vocabulary to describe what's happening in your body accurately so that a doctor has what they need to investigate properly rather than reassure you reflexively. Doctors see an enormous volume of patients describing fatigue, back pain, and appetite changes, and the overwhelming majority of those cases turn out to be something far more benign. That's not a reason to stay quiet about symptoms. It's a reason to be specific, because specificity is what separates a symptom that gets taken seriously from one that gets filed away as normal aging. And here's the part that actually determines outcomes more than almost anything else: how clearly that conversation happens. Survival odds for pancreatic cancer differ enormously depending on the stage at diagnosis, and stage at diagnosis depends heavily on how early symptoms get investigated. So if any of this sounded familiar while you were listening, here's a concrete next step. Write down each symptom you recognized, when it started, how often it happens, and whether it's been getting worse. Bring that list to your doctor and go through it, item by item, rather than summarizing it as "I've just been feeling off lately." Specific, detailed symptoms tend to prompt specific investigations, blood work, imaging, referrals, while vague descriptions are more likely to get a wait-and-see response. If your doctor doesn't seem inclined to investigate further and your symptoms persist, it's entirely reasonable to ask directly whether an abdominal ultrasound or CT scan makes sense given the combination of things you're experiencing. That's not being difficult. That's being an informed participant in your own care, which is exactly what this moment calls for. Before we wrap up, it's worth touching on the practical side of what happens after that conversation with your doctor, because knowing what to expect can make the whole process feel less intimidating. If your description of symptoms raises enough concern, the typical next step is imaging, usually a CT scan of the abdomen, sometimes an MRI, or an endoscopic ultrasound, which allows a specialist to get a close, detailed look at the pancreas from inside the digestive tract. Blood work may also be ordered, including a marker called CA19-9, which can be elevated in pancreatic cancer, though it isn't reliable enough on its own to diagnose or rule